welcome to our webinar. Today, this is being delivered by the Wellbeing Line and it should only take 30 minutes. My name is Martina Halmadi and I'm a psychologist at the Wellbeing Line.
And my name is Rebecca Paris and I'm also a psychologist with the Wellbeing Line.
And we will be taking you through an overview of stress, burnout, and the cost of caring. It is only going to be an overview, so we can only cover a little bit, but our contact details are at the end of the presentation.
Please take this opportunity to pause the webinar to get comfortable and grab yourself a drink if you need to.
So this is a safe space agreement. Nothing is intended to be difficult or triggering, but we will be talking about the ways in which we might struggle. So please look after yourself. So now we'll start our webinar with what is mental health. And as you can see, mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well, and work well and contribute to their community. Mental health exists. It is very important. We need to look after our mental health, and it exists on continuum rather than kind of having or not having good mental health. So we all need to look after our own mental health, as well as our physical health. So if we now look at next slide, this is thinking about our jobs. It's really important to consider that our jobs are set in context, they are occurring in a work context. So there are certain aspects that will impact on how we feel. So we're thinking about relationship, workload, and workforce. So relationships, very much relationships with colleagues, line manager, difficult experiences as bullying and racism will negatively impact on our experience at work, and resilience, which is often talked about. But actually really good relationships within teams are a key factor to resilience. There are other systemic factors as well. So when we think about workload, the nature of our workload will be always very important. Questions such as, is this a manageable workload? Is there a good balance between stressful and less stressful tasks? Do we have access to supervision, reflective practice, and of course, training? Workforce as a third area is looking at, do we have enough staff? So shortages of staff or not having staff with the right skills that will impact on us within this context and working environment. Of course, this is not exhaustive list and there might be some other things included in this, and different things will impact differently on people.
So why are we talking about this now? Why are we thinking about looking after our own mental health and looking after our mental health and well-being at work? Well, we have come through a time of unprecedented challenges and changes in the NHS and across the social care sector. We can't forget that we have come through a period where we had a global pandemic, which changed the way we our working lives, but it also changed our home lives. So there were quite a few stresses around at that time. And unfortunately, with the guidance around COVID, we might not have been able to operate our own self-care strategies that we would have usually used. So, for example, going and seeing friends and family or doing the activities that we enjoy. So we really need to think about why now? Why do I need to look after myself now? Because I guess what a lot of people have noticed is they might be feeling that build up of stress more easily. And we know that stress can build up gradually. We know that from research, and we'll talk a little bit more about that later in the webinar. We know that, unfortunately, organisations, the places that we work, can be potential causes of suffering. The systems that we're in, the processes that we have to follow, or the targets that we can have to meet often build up our stress levels. We know that for some, well, for most of us, that work can be physically, but it also can be emotionally tiring. In order to care for other people, we need to step into a space where we are able to understand their distress, and that can have an emotional cost for us. So there can be a cost to caring. I really like this quote, and I think it really describes that feeling. So the expectation that we can be immersed in suffering and loss on a daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. So we need to acknowledge that if we have a job that has a caring role, that we are actually going to be stepping into that distress of others, and we need to look after ourselves as well. We also need to recognise that even if our job isn't on the front line, that there will be loads of expectations that are placed on us, be that deadlines, reports to manage, emails coming in. So we are all experiencing some level of stress and threat on a day-to-day basis. So what can we do? Well, firstly, we can recognise that self-care is vital. In order to care for other people, or in order to care for other people both at work and in our home lives, we need to be able to care for ourselves first. So if we think about on a plane, in the safety announcement, they will tell you to fit your own oxygen mask first before helping others fit theirs. And the reason is for this is that we're not much good at helping other people if we're passed out on the floor. So it's really essential to think about how we look after ourselves and operate our own self-care practices in order to be able to care for the people that we work with, but also the people that are outside of work.
Thank you, Becca. Now we're going to be talking about stress. And as you can see, stress are the demands of situations that exceed our capacity to cope with these. It's really important to think about the stress, because humans really function only when they have appropriate or some amount of stress. So we are not very good at managing our lives very well when there is too much stress and when there is not enough stress. Stress can be part of the burnout, but if you look at the different parts of this stress, whether that's health, finances, childcare, deadlines, different people will find different things stressful. But it's really important to think about how does that make us feel very uncomfortable, and it can be very unhelpful. So if we look at the next slide, and that's different types of stress, we generally speaking, or broadly speaking, we recognize two types of stress, and that's acute and chronic. Acute is very short period of time, usually days or few weeks. It's very intense and often after a very sudden occurrence like bereavement or illness. This triggers very common experience or reaction rather, and that's fight or flight. This is our threat base circle, which we will explain a bit more further down the line. And it really activates something within us that wants to resolve the distress. But this is also very, very exhausting. So if the stress is then chronic, so long-term or long periods of time, it's recurrent, and we constantly feel under pressure a lot of time, whether that's at work or home, or the combination of the two, it can be very unhelpful. Again, different people will have different stress triggers. They will differ in what type of stress or amount of things that they can cope with, because we are all individuals. And then very simple things as lack of sleep, not having proper food for lunch, or just needing a glass of water. This will also add to our stress. It's really important not to compare ourselves to others, as this can be quite unhelpful. It's really important to think about how do we cope with stress. So next one we're going to talk about is thinking about our stress bucket. So if we imagine that within ourselves we have stress bucket that kind of holds the different stresses, we need to think about it in a way that within our bucket we also already have things that just are there like stones, whether that's past relationships, difficulties we experience in trauma or childhood, whether that's losses we've experienced and other significant life events. These are already in our bucket. And then when things rain in, different stresses, this can be very small, such as losing a house key or car key, or very big, such as losing a job or bereavement. This will be filling up our bucket, and it will be taking the space up. And therefore, we will have less ability to cope with the stress. And obviously, as humans, we all have different sizes of this bucket. We will experience different, we will have different experiences, and we will vary in how much stress we can individually manage. So what's really important when our bucket is filling up is to put a tap on it. So really thinking about what helps me to de-stress, to decompress, whether that's very simple things, again, as having a glass of water or a sandwich, or kind of exercise, connect with other people, or needing to do a bit of mindfulness or relaxed breathing exercise, whatever that might be. It's really important to really do that, because then the bucket might overflow. If you look on the other side of the bucket, things that can reduce the stress in short term, but can actually increase it in the long term, this is really important, because you can see that it kind of feeds right back into the bucket. And quite often this will be things that help us. Maybe it's postponing the important work we need to do on a project. Maybe it's having a glass of wine. I mean, it will probably make us feel better in short term, but if we continue doing that in long term, it will be feeding right back, because our life will be more difficult. So whatever is helpful, it's really important to recognize your own early warning signs, which you can kind of notice around what makes me feel more stressed, potentially more short-tempered or a bit snappy, whatever that might be, or difficulties with sleeping. And then what happens when the bucket overflows? What is my reaction in that? We might feel hopeless or helpless. There might be real difficulties in functioning in kind of day-to-day life. Or the other one, there can be really frantic activity or absence of usual activity. So when we think about the next one, how does stress show itself? We really have 5 different areas. And again, this will be very individual, but it's important to know this about yourself. So first, we are thinking about impact on our body. So this will be physical sensations, whether that's headaches or heart racing, muscle tension, or general kind of discomfort. But bowel problems are quite common with stress, and feeling tired and exhausted. Then it can have impact on our emotions. I might be more irritable, I might be quite angry, worrying or over worrying, I might feel quite low, hopeless, and overwhelmed. When we think about our thinking, we might notice some patterns, ruminating. So we go over and over something that has already happened. We might be more likely to overthink things, or have very negative thinking patterns, like catastrophizing, comparing ourselves to others. And of course, very common self-criticism, being forgetful, and difficulties in concentrating. When we think about our behavior, we might notice small changes, which kind of are part of those warning signs. It might be, again, very simple as eating more or less, or sleeping more or less. Again, it will be very individual, but also kind of unable being settled down, or wanting to be constantly busy, having lots of unfinished jobs, but also things like drinking or smoking, maybe feeling tearful. When we think about our relationships, there might be some changes in our relationships with others. We might avoid or completely withdraw from social contact, or we might seek reassurance and contact with others, but it's never quite fulfilling. And this might go round and round in circle. So what is burnout? The definition by the World Health Organization reads that it's energy depletion or exhaustion, increased mental distance from job, negativism, cynicism, and reduced professional efficacy. When we think about burnout, it can affect any person in any job. People can recover from burnout quite quickly once they stop working, which is slightly different to depression. So as I said, burnout is often kind of sound quite dramatic and sometimes final, and people think there is no way back from burnout. But this is quite unhelpful, because there is a way back from burnout, and it can be reversed. However, it will be important to recognize and make changes where we can. What can happen with burnout is that people turn up to work, but actually are not feeling well to actually work. So this is called absenteeism. Or people might be working too much, even when they are not supposed to, so they don't necessarily rest properly when at home. So it's really kind of a battery without charge. And recharge might be very simple, as taking lunch break or laughter and feeling good about your work. Okay. Thank you very much. So next one is thinking about the difference between stress and burnout. We talked about stress and burnout, so let's look at what's common and what's different between these. So stress, even if there is lots of stress, generally it feels manageable. It can be frustrating. And lots of stress or chronic stress can lead to burnout. But generally speaking, stress can be managed through being able to take breaks and being still hopeful that things can improve. However, with burnout, we feel quite empty. There is loss of meaning. Having a break at work doesn't quite help us to feel recovered. It might actually cause more anxiety. When we think about our emotions, in burnout, we don't necessarily feel things. We might be quite numb. In stress, we might be very reactive. So there are definitely differences between stress and burnout. Stress we can notice, we can quite often, or we are able to say, I feel quite stressed or under a lot of stress. With burnout, we might not always notice that it happens, but we can be more aware of different feelings. So burnout normally happens after an extended period of stress. If we think of our stress response as mobilizing our energy to get our body ready, this makes complete sense. So we are looking at now at the pyramid that's based on Maslow's hierarchy, which you might be familiar with. The main idea is to think about how we need to address our basic needs first. We already said hydration, nutrition, sleep, healthy work-life balance, which can get forgotten about, especially when we are quite busy at work. But the question is, would you let your patients or colleagues go without food and drink? So we can kind of support ourselves and each other to address our basic needs. However, then we have psychological needs, and these are really kind of thinking about feeling hurt when we are concerned, and when we think about our organization, we can think about feeling connected. We feel sense of belonging, and part of that might be compassionate leadership. We then feel confident. We might be able to, or we feel that our hard work is recognized and rewarded, and that our voice counts. So we feel appreciated and valued. That's really important before we can go to the learning, thriving, and creativity level. So it's really important to start with basic needs to be able to climb through that pyramid. There is lots of different things that we can do when it comes to self-help around basic needs. For example, with sleep, we can access treatment as well for example, for insomnia. Okay.
So why is it important to then look after ourselves and think about our own self-compassion? Well, compassion, we know compassionate care can be really helpful in order to look after the people that we support. You know, it involves kindness, stepping into that person's distress, empathizing, listening, caring. But so compassion is not an emotion, it's a motivation. It's guided by two psychologists. So it involves that ability to notice and tolerate that distress and suffering in someone else. And it organizes us to alleviate that suffering. So good compassionate care has been associated with better outcomes for people, better quality of life. We know that's really important. It is empathy plus action. It's the motivation. However, we're very good at recognizing this and often doing this for other people, but we're not so good at doing it for ourselves. We're not very good at offering ourselves compassion, but compassion flows three ways. So many of us are able to offer compassion to others. That's from others from self to others. The second flow of compassion is actually being able to offer it from ourselves to ourselves, and we might have difficulty with this. So we can operate a double standard. So that is, we might judge ourselves much more harshly than we would someone in a similar position. And as Martina said earlier, we can often get into these thinking patterns, particularly around self-criticism. So when we're feeling stressed, we can be additionally critical to ourselves and our own responses. I shouldn't have done that. I ought to have done that. I must do this. The third flow of compassion is actually accepting compassion from others. So that's from others to self. And we might also struggle to accept compassion or help from other people. And that can mean that we don't always ask for help. There can be many, many reasons for this. And again, they'll be very individual, but we might really struggle to kind of recognize that we need the support. We might struggle to think about whether we actually deserve the support, whether our problems are enough. We might also feel like it's really hard to admit that we need that support because it can tap into those feelings within us around feeling like we failed in some way. So self-compassion, whilst it is so important, it can be really difficult to do. So how do we start to develop self-compassion? Well, Paul Gilbert, in his compassion-focused therapy model, talks about three emotional systems. We call them the three circles. And by understanding our emotional systems, we can start to bring some awareness to our responses. So start to bring some awareness about why I've responded in a certain way and develop some compassion towards these. So I'll talk you through them now. So the first circle is the threat system. So this is because our bodies and our brains have been designed to keep us safe. It's the fight or flight. So it's driven by adrenaline and cortisol. It's preparing us for action. It's threat focused and safety seeking, and it's associated with the emotions anxiety, anger, and disgust. It's trying to keep us safe, but it gives us a lot of false positives. So it doesn't your brains don't distinguish very well between a direct threat to life and something that's more of a perceived threat. We still get the same response. The second emotional system is our drive system. This is the blue circle. It's associated with achievement, motivation, excitement, joy. It's our attainment system. So it's if in evolutionary terms, it's, you know, how it helped us to get things, to get the cave, to get the food. And it has a neurotransmitter response. It's dopamine. So we get some nice buzzy feedback when we've done something that gives us a sense of achievement or brings us a sense of joy. The third system is our soothing system. The other two systems are high energy systems. The soothing system is a lower energy system. In evolutionary terms, it was the bit that was designed to help us rest and digest, to recover after a period of high stress or high activity. It's associated with contentment, a feeling of safeness. So not just safety seeking, but a feeling of safeness. It can a connection, and because we're a social species, and affection. So it's associated with oxytocin, which is the love hormone. Sometimes, though, when we are in a work situation, when we feel quite a lot of pressure and stress, we can get into caught between the threat and the drive systems, and that's called threat-based drive. So that is, we deal with any incoming threats and stresses by getting busy and doing. And the trouble is, if we get caught between these two systems, we can get less of that nice, positive, buzzy feedback from the dopamine response. So we're just keeping going, keeping going. We can also be much more reactive as well. So we're responding to things in a more reactive way. So we're making decisions that when we look back on them, we might think, well, why on earth did I do that? So it's really important to recognize when we get caught between this threat and this drive system. Unfortunately for us, if we do get stuck between these two systems, we're not able to step out and slow down and soothe ourselves and have that space to not just do, but just to be, then one of the unintended consequences for us can be impacts on our physical health, but also impacts on our mental health. And that could be burnout. If you think about that high energy and continuing to do all of those things, it can really deplete us over time. And it's the reason it's important to recognize these three systems and we start to bring some awareness to this, because sometimes they might look nice and balanced like this, but other times they might look completely out of alignment. And we know that threat is a bit like a garden that you leave unattended. The weeds will grow. So threat can take over if we're not paying attention to it. And it can be harder to access our blue system and our green system. And that's really important. So we really want to be able to find the nice things in the blue system, the things that still bring us joy. And we need to work on those to find things to kind of support our own compassion, our self-compassion, things that motivate us, that give us a drive to still continue the work we do. But we also need to find space to slow down. And we might do this outside of work, but it's really important to find ways that we can do this within work as well. So how do we find ways to slow down in a day that might be very, very busy? There are times when we have a huge amount of stress coming in and we aren't always able to reduce this. And sometimes this model can be quite helpful to think about it when we think about our incoming stresses and threats. And that is what's within my control and what are the things that I have to accept. So there might be things that are coming in that I can control, so I can control my compassion to self and others, my own responses, my boundaries, my self-care. And then I can think about, well, if it's not under my control, can I influence it? So can I reach out? Can I ask for help? Can I raise concerns? Can I think about how I influence workplace culture? Or can I work together with my team or with my line manager? And then if I can't control or influence it, can I accept it? So there might be things that are completely out of our control that raise our stress levels. So lack of resources, waiting lists, winter pressures, staff sicknesses or shortages, the political climate. So there are certain things that we have to work out whether I can just accept that and to a certain extent let that go. Because sometimes that helps to kind of let go some of this threat that I can't do anything about. And if we think about ways that we can then develop either the nice part of our blue system or how we can develop and grow our green system and really bring some awareness to that, there are lots of ways that we can do this both inside and outside of work. They're all up on the screen at the moment. But I suppose the main thing is about getting that connection with other people. It might be, depending on how comfortable you feel, like having a hug or a conversation or sitting with someone, a text message. It might be reaching out. The other way, it might be actually spending time on your own. So it might be focusing on your own well-being, on your breath, taking a break that's on your own, or actually just spending some time outdoors and in nature, really utilizing the senses. So there'll be lots of ways that you can grow your green, but just reminding yourself that green isn't always the busy activities. It's the slowing down and it's the being rather than the doing. So what we encourage you to do then, if we think about compassion is empathy plus action, and we encourage you at the start of the webinar to take some time to get comfy and listen to this and grab a hot drink, we want to step out compassionately. So what I'd like you to think about before we finish today is one thing that you might be able to leave behind in this webinar. What can you leave here like a piece of old baggage? And then I would like you to think about one thing that you can take away or take forward from this webinar. Something that you can do, that you can actively work on your own self-compassion. You can grow your green. So just take a moment to think about that.
And after this, we can show you that we offer different levels of support at the Wellbeing Line. So we offer individual, team leadership, and organizational. If you'd like to receive individual support, you can call our line on 0300 421 7500 or email us, and we'll have more details at the end in the last slide. But also we offer team support, and if you think that that's what your team needs, you might need to request that through your line manager who would contact us. So on our last slide, there are all our contact details, and I would like to thank you for listening and engaging today, and I hope that you found this helpful. If you'd like some more help or support, please feel free to contact us through provided details. Thank you very much.